Imagine snapping your leg bone clean in half. No hospital, no surgeon, no painkiller, just dirt, open air, and whatever your group could figure out on the spot. A deep cut could kill you. A broken bone could kill you. Childbirth could kill you. Infection could kill you. And yet for 300,000 years, humans kept surviving anyway. They kept reproducing. They built the foundations of everything we now call civilization, with no pharmacy, no antibiotics, nothing we'd recognize today as medicine. So how did they actually pull that off? The answer isn't what you'd expect. Here's the thing. Ancient humans weren't just enduring illness and hoping for the best. They built an actual medical system out of nothing but watching, testing, and time. Nobody wrote it down at first. Nobody organized it the way we organize medicine today. But it worked well enough to keep people alive through conditions that would wreck most of us within days. And here's the wild part. Pieces of what they figured out are still sitting in your medicine cabinet right now. Let's start with plants. Not in the gentle herbal tea sense. Real pharmacological compounds hiding inside bark, roots, leaves, and fungi that genuinely do something to the human body. Nearly half of all prescription and over-the-counter drugs today trace back to plant compounds. Aspirin came from willow bark. Digitalis used for failing hearts came from foxglove. Atropine came from nightshade. Modern chemists didn't stumble onto these by accident. Ancient humans found them first, the hard way. Trial and error repeated across generations. Someone ate a plant, their fever broke. Someone else remembered, they taught it to their kids. One person's accident became the entire group's survival advantage. And here's a detail nobody talks about. The Iceman already knew this 5,300 years ago. When researchers studied the naturally mummified body found frozen in the Alps back in 1991, they found something strange tied to his gear. Birch polypore fungus, threaded onto a leather cord. Turns out that fungus causes targeted digestive disruption when eaten. The Iceman had intestinal parasites. He was treating them. He wasn't wandering the mountains hoping his body would sort itself out. He was carrying medicine on purpose. Before Egypt built its first pyramid, before the wheel was even common, a man crossing the Alps had a curated personal pharmacy strapped to him, and he knew exactly what it was for. But plants couldn't fix everything. Open wound, cuts down to the bone, the kind of injury that invites infection and kills within days if nothing's done. And this is where it gets genuinely strange. Archaeologists keep digging up skulls with holes in them, clean circular holes with fresh bone growth around the edges. Bone only grows back like that in a living person, which means these people survived. This is trepanation, drilling or scraping straight into the skull, and it's one of the oldest surgical procedures we know of, going back at least 10,000 years across Peru, France, Russia, and parts of Africa. Groups that never met each other, separated by oceans, all independently figured out how to cut through a human skull without killing the person underneath. No anesthesia, no antibiotics, no sterile tools of any kind. So what were they actually doing? The earliest method was scraping a sharp stone tool dragged back and forth across the bone, grinding through layer by layer until it broke through, all without touching the brain underneath. That alone takes serious anatomical knowledge. But here's the part that really gets me. The evidence shows they practiced first. In Peru, archaeologists found skulls with drill holes that get progressively deeper and more precise over time, like someone training before they ever touched a living patient. Stone Age surgeons were running rehearsals. They understood that skill takes practice before you risk it on someone whose life is on the line. And it worked. In some Peruvian populations, survival rates after trepanation hit somewhere between 80 and 90%. The bone regrowth proves people lived on for weeks, months, sometimes years after the surgery. That's not luck. That's technique, refined and passed down carefully enough to repeat reliably in societies with no written language and no medical schools. Just generation after generation teaching by watching. Now here's where it gets even stranger. In ancient Egypt, they were writing all of this down. Around 1550 BCE, Egyptian physicians put together a scroll called the Ebers Papyrus, cataloging over 700 medicinal compounds. It covered infections, digestive problems, wound care, pain relief, even described the circulatory system and how to check a pulse, centuries before anyone knew germs existed. Alongside it sits the Edwin Smith Papyrus, basically a trauma manual from around 1600 BC, walking through fractures and dislocations case by case. Symptom, treatment, expected outcome. These weren't superstition dressed up as science. These were field notes from people who'd treated enough patients to spot patterns and write down what actually worked. But most ancient cultures had no papyrus, no writing at all. So how did the knowledge survive? Through people. Every culture had its specialist, shamans, medicine keepers, midwives, healers. These weren't mystics waving bones in the dark. They were technical experts who spent their whole lives building up botanical knowledge and hands-on skill, often training from childhood until death. When a healer died, everything they knew passed to whoever had trained beside them for years. We tend to dismiss oral tradition today, but it preserved specific medical compounds across thousands of years, accurately enough that researchers can still trace the same plants in traditional medicine on opposite sides of the planet. And women were at the center of almost all of it. In most hunter-gatherer groups, women did most of the plant gathering, which meant women built the deepest knowledge of what each plant actually did. They administered remedies, tracked symptoms, delivered babies, treated sick kids. A woman handling a difficult birth in a forest clearing, with zero equipment, was operating on more hands-on expertise about that exact moment than most people today will ever build about anything. Here's one more thing that sounds bizarre until you think about it. Clay. Across dozens of completely unconnected cultures, people packed specific clay and earth onto wounds. For a long time, scientists assumed this was just ritual. Then they actually tested it. Turns out, certain clay minerals genuinely kill bacteria, including some strains that resist modern antibiotics. How'd ancient people figure that out without a lab? Probably the same way they figured out everything else, by watching. Sick animals seek out specific soils, primates rub clay into wounds. Ancient humans were paying close attention to the natural world in a way most of us never have to anymore, and they used what they saw. That's not superstition. That's science without the vocabulary to explain itself. Still, none of this fully solves the hardest problem: infection. Without antibiotics, even a small puncture wound can turn deadly within days. What ancient people had against it was limited, but it wasn't nothing. Honey kills bacteria. That's documented in modern labs. Garlic contains allicin, a real antibacterial compound. Mold growing on stored food was likely producing early penicillin-like substances applied to wounds with zero understanding of why it worked. They didn't know what bacteria were. They just knew some treatments reduced the smell, brought down the swelling, kept a wound cleaner. They worked backward from results. The mechanism came thousands of years later. The results were enough to keep the knowledge alive. To be clear, life expectancy still sat somewhere between 25 and 40 years for most prehistoric people. Infection, childbirth, and injury took a brutal toll. Ancient medicine wasn't as effective as a modern ER. That's not really the point, though. The point is they built a system at all. Messy, regionally inconsistent, tangled up with spiritual belief in ways that confuse us now, but a real system built across thousands of generations of watching, testing, failing, and trying again. The healer pressing willow bark onto a fever didn't know about salicylic acid. The fever broke anyway. The Egyptian physician cataloging 700 compounds had no idea how pharmacokinetics worked. The compounds worked anyway. Ancient medicine lived entirely in that gap between not knowing why and knowing that it worked. And here's what's hard to shake once you sit with it. So much of that knowledge is just gone. Plants identified and traded across prehistoric networks for their medicinal properties are now extinct, or simply unknown to us. Oral traditions that carried medical knowledge for thousands of unbroken years collapsed the moment the communities carrying them collapsed. A huge amount of ancient botanical knowledge vanished for good when those communities were wiped out, which leaves a question that doesn't have a comfortable answer. The most advanced medical knowledge our species ever built wasn't sitting in a library somewhere waiting to be rediscovered. It was living inside specific people, and when those people were gone, it went with them. Life expectancy still hovered somewhere between 25 and 40 years in most prehistoric populations. Infection, childbirth, and injury claimed enormous numbers. Ancient medicine was not as effective as what a modern emergency room delivers in the first hour. That comparison is not the point. The point is that ancient humans assembled a system, imperfect, regionally inconsistent, frequently entangled with spiritual belief in ways that modern observers find confusing, but a system. Knowledge accumulated through thousands of generations of watching, testing, failing, and starting over again. The shaman applying willow bark compressed to a fever patient didn't know about salicylic acid receptors, but the fever came down regardless. The Egyptian physician cataloging 700 compounds didn't understand pharmacokinetics. The compounds worked anyway. That gap between mechanism and outcome is where ancient medicine lived, and it kept people alive long enough to pass down what they knew. What remains strange and harder to shake the more you sit with it is how much of that knowledge is simply gone. Plants that were carefully identified, cultivated, and traded across prehistoric networks for specific medicinal properties are now extinct or unidentified. Oral traditions that encoded medical knowledge for thousands of continuous years collapsed when the populations carrying them collapsed. Researchers estimate that significant portions of ancient botanical pharmacology technology vanished permanently when colonial disruption destroyed the communities that held it, which raises a question that doesn't really have a comfortable answer. The most sophisticated accumulation of medical knowledge our species ever built wasn't sitting in a library waiting to be found. It was living inside specific people, and when those people were gone, it went with them.